Doctor, you mentioned craniotomy? Yes, I did. And what is craniotomy? It is the opening of the skull. And doctor, how do you do that? You do it by a burr or trephine openings into the skull, which are made in order to prepare a bone flap. Doctor, is this osteoplastic? Yes, the flap is osteoplastic, and it is separated from the skull during brain surgery and replaced when the skull is closed. Doctor, is that called osteoplastic craniotomy? Yes, it is. It is a common method of approach to the brain. Doctor, what is cryoneurosurgery? Cryoneurosurgery is the operative use of cold in the destruction of neurosurgical lesions. Is there, doctor, a decompression of the brain? Well, there is a decompression or removal of a piece of skull bone, usually in the subtemporal region, with opening of the dura mater to relieve intracranial pressure. Doctor, the spinal cord is what? Well, there is a removal of bone fragments, hematoma or lesion, to relieve pressure on the spinal cord. Doctor, what about drainage of the meninges? Yes, drainage of the meninges for abscess or hematoma is the evacuation or exenteration of subarachnoid or subdural space. And doctor, there is an excision of the brain lesion, is there? Well, it is a complete removal if the lesion does not encroach on a vital center. Doctor, what is laminectomy? Laminectomy is the excision of one or more laminae of the vertebrae method of approach to the spinal cord. Doctor, how about microneurosurgery? Microneurosurgery is the use of the surgical binocular microscope, which provides a powerful light source up to 25 times magnification and a clear stereoscopic view of the brain. Microsurgical techniques and dissection are employed. They are employed for what, doctor? They are employed for acoustic tumors, cerebral aneurysms, pituitary tumors, spinal cord tumors, and other neurosurgical procedures. Doctor, what about the operations for Parkinsonism? Well, the surgical procedure directed toward the destruction of areas of basal nuclei, presumably affected by the disease. Yes, you are correct. And pallidotomy? Pallidotomy, formerly called pallidectomy, is the surgical interruption of nerve pathways coming from globus pallidus to relieve intractable tremors and rigidities. Doctor, is there a division of nerve fibers? Yes, there is. And what is that called? It is usually achieved by use of electrocautery or chemical solution, cryogenic agents, ultrasonic waves, and stereotaxic techniques may be employed. Doctor, thalamotomy is what? Thalamotomy is formerly thalamectomy. It is the partial destruction of the thalamus for relief of tremors and rigidities. The stereotaxic instrument is applied to the skull. By means of radiographic visualization, the target area is located and lesions are created by electrolytic, chemical, ultrasonic, or cryogenic methods. Doctor, what is stereotaxic neurosurgery? It is the operative procedure that uses three-dimensional measurements for precisely locating the neurosurgical target area in acromegaly, cerebral aneurysm, diabetic retinopathy, manic depressive reactions, Parkinson's disease, psychogenic pain, and temporal lobe epilepsy. Doctor, you mentioned stereotaxy? Well, close to that. The use of stereotaxic instrument fixed onto the skull with screws like a scaffold. Doctor, is that a probe? Yes, from this, a probe containing either a chemical, electrical, or cryogenic agent is introduced through a burr opening into the target area of the brain. Getting the hang of these things?
I think so.
As long as you have all the words in your dictionary.